Important surgeries have been postponed because of the coronavirus, but the governor in Arkansas giving the green light to Arkansas doctors to resume elective procedures starting on Monday. But local doctors are telling us new restrictions might make it difficult for them to get back into the operating room. 5 News reporter Nick Camper live to explain why. Nick?
Elective surgeries are non-emergency and typically don't require the patient to stay overnight, but there's a lot of planning that is involved when it comes to personal and travel scheduling, along with insurance agreements. Adding COVID-19 testing to the list makes the job a lot more stressful.
You know, what we're seeing is that, elective surgeries are on, but there's a lot of caveats to that.
Governor Hutchinson and Secretary Smith say elective surgery patients will need to get tested for COVID-19 before they go in for their procedures. Dr. Josh Roller with Roller Weight Loss and Advanced Surgery says this is something that not every hospital and clinic can accommodate.
We've not been doing any of the testing already.
The test results will need to come back negative with a response time of 48 hours. Secretary Nate Smith says there is an adequate number of tests with this capability.
There are commercial labs, though, that can give a rapid turnaround.
Dr. Roller says the 48 hours is too short of a time frame for many patients. If a procedure was on a Monday or Tuesday, that would mean they would need to go get tested on a Saturday or Sunday. And dealing with the insurance companies is also a difficulty with planning. He says they have to know the date of the surgery before helping with the payment, so scheduling procedures will not always be quick.
A typical weight loss surgery patient, it could be as much as 6 months in advance from when you start our program.
Dr. Roller says he's been in constant communication trying to figure out a way to set these procedures for the coming weeks ahead. Secretary Smith reiterates that commercial labs should have the inventory to assist those who need testing.
If they make some phone calls, I think they'll find commercial labs that can assist them in getting that 48-hour turnaround.
Dr. Roller says he's lucky to still have his staff available. He says they will make adjustments to accommodate this new opening date.
We're going to work extended hours in the operating room. We're going to add Saturdays where necessary.
Dr. Roller says for those people who had surgery scheduled for the upcoming weeks, they will be treated first after proper COVID-19 testing. And for anyone who had their schedules postponed from the month of April, they'll be contacted soon and they will be rescheduled for a later date. Live in Fayetteville, covering news where you live, Nick Camper, 5 News.